Imagine shrinking your waist by several inches permanently without endless corset training or just liposuction. In 2025 and 2026, rib remodeling exploded as the hottest and most controversial body shaping style. But is it safe? Does it really work? Let's break it down. Traditional rib reduction used to mean surgically removing parts of your lower floating ribs, ribs 11 and ribs 12, that don't attach to your sternum. It could give dramatic waist narrowing but came with bigger risks like chronic pain, breathing changes, or long scars. However, today most surgeons do rib remodeling, also called rib shaping. Instead of removal, they make controlled fractures or what we call green stick breaks. Then they reposition the ribs inward and sometimes they shave or shape them up. And what is the goal? A naturally narrower, more defined waist, often 2 to 6 inches smaller in circumference, while keeping your ribs intact for protection and structure. The procedure is usually done under general anesthesia. It takes 1 to 2 hours and uses tiny incisions, sometimes pinhole or scarless techniques, which is guided by ultrasound. Right after the surgery, you have to wear a tight corset for 8 to 12 weeks to help the bones heal in the new position. Many patients see instant cinching, some report dropping from 32 to 26 inches. Full results settle in 3 to 6 months as swelling fades. It's often combined with lipo for even better curves. Patient satisfaction is high in recent studies. People love the hourglass silhouette that diet and exercise alone can't achieve. But let's be real, this is still surgery. Common side effects of the procedure include chronic pain, swelling, bruising, and needing to wear that corset constantly. There are other rare complications from recent meta-analysis studies done in 2025 in hundreds of patients like pneumothorax, asymmetry, severe pain, or infection. Rib removal carried higher risk like reduced organ protection, respiratory complications, which is why remodeling is now preferred. Experts agree, when done by experienced board-certified plastic surgeons who use imaging and proper technique, it is considered low risk with a good risk-benefit balance. Still, it's not for everyone. Not mainstream like liposuction, and results may vary depending on your body's anatomy. This is purely cosmetic for people who have run out of options for non-surgical options and they want that exaggerated hourglass look. It's expensive, typically 1 million to 2.5 million Kenyan shillings using the current rates. It requires serious recovery plans and it demands realistic expectations. If you are curious, research on board-certified specialists in advanced body shaping, look at real before and afters and get multiple consultations.